So I'm actually going to talk to you today about assessment in professional programs because I started a conversation recently at the conference, the Association for Assessment of Learning in Higher Education in Albuquerque a couple of weeks ago. And speaking with people in the professional schools especially, I find that some were and some were not really leveraging the advantages that we all have in the professional schools. So I want to focus on that and talk to you about it today. And why is it that assessment is actually easier for us? And I do believe that it is easier for us. When I say us, I am including all the people out there who are in professional programs who have things such as specific standards. So in addition to having the standards by the regional accreditors, such as Middle States and SACS and NEASC, et cetera, they have very specific standards related to their professional programs, and even very importantly, have licensure exams at the end of those programs. So what does that really mean? It means that people in our environment, in our schools, really faculty, are accustomed to monitoring outcomes data. And think licensure pass rates. At the end of every year, professional schools generally receive the licensure pass rates and report on them. If you have a 98% pass rate on your licensure exam, that's surely something that your accreditors want to know, but also any prospective students want to know. Parents want to know. It's something that's very, very valuable to many audiences. So if you know that you're going to be checking your licensure pass rates at the end of the day or at the end of the year, then certainly you want some information leading up to that. How are the students doing? Do I have any predictors of that success? Do I know what track the students are on to get to that ultimate goal? So those licensure pass rates are something that we enjoy, that actually someone, let's say if you're a history major, there's no licensure pass rate at the end to say, okay, our student spent 4 years as a history major at our institution, and we can tout a 98% pass rate on a national exam. They don't have that benefit, and I really look at it as a benefit. We understand the value of monitoring student progress in a whole different way, because then we can look ahead and say, we feel confident that our students are going to be successful because we've monitored their progress throughout the entire program. So think about, there's a whole lot of programs out there that require exit exams and licensure pass rates. Business, if you're looking at AACSB, you might have people in accounting that have CPA exams. Pharmacy, AACPE has is our accreditor and has the NAPLEX exams. Medical, nursing, podiatry, education, osteopathy. These are just some examples with professional schools that have very clearly defined outcomes that are identified by the accreditors, and that can drive what type of information you're collecting from your students along the way, and that's what we're really going to talk about using. This is the just right from the United States Medical Examination licensure webpage, and if you look, they tell you right there, step 1 test includes test items in the following content areas: anatomy, behavioral sciences, biochemistry, etc. So you're going to want to know how the students are doing in each of those areas. What are the strong points? What are the weak points? Long before they ever get to the step 1 exam. Similarly, in pharmacy, the NAPLEX is the licensure exam for pharmacists. And there's a blueprint online. So usually for any licensure exam, there's a blueprint available. What are they going to be asking? What are they going to be covering for that exam? And it generally is in alignment with what the learning outcomes are required by the accreditors. And here's just an example of the start of the NAPLEX blueprint for the schools of pharmacy. Another tool that pharmacy schools use is a voluntary exam called the Pharmacy Curriculum Outcomes Assessment, or the PCOA. And they give you a blueprint that's broken down very broadly into 4 main areas: basic biomedical sciences, pharmaceutical, social, behavioral, and clinical. every professional school is going to have a defined set of standards that you can use and use that to collect information throughout the student's professional program. So the example I'm showing here is actually what we're using in the School of Pharmacy. Appendix B is actually some guidelines for the standards for pharmacy schools. There are actually 35 different B items, but broadly the categories are anatomy and physiology, pathophysiology, microbiology, etc. We want to know how the students are doing in all of those key areas long before they get to the end of the programs, long before they take the pharmacy curriculum outcomes assessment, or certainly before they leave us and take their licensure exams. So how are we collecting that data? We're capturing it because we're looking at tests that we give to students throughout the program. Every single year, every single semester, and in some cases every week, we give an exam to the students. So what we do is we look at each of the exam items and say, well, what is that covering? What are the learning outcomes being addressed by those exam items? And we capture them, we code them according to the categories that they address. So we're collecting an awful lot of data, and we're doing this, and it's causing us or enabling us to map our curriculum at multiple levels. For us, I'm not going to spend a lot of time on this slide because this is just our level, but what we're doing, we're looking at our accreditation standards, we are looking at Bloom's taxonomy, we're looking at cumulative questions, course level outcomes, and systems. And as I get into this, I want to show you how some of this data is used. Right now, I want to say that we're collecting a great deal of data from every single exam or test that we give our students, because all of that has the potential of telling us how the students are doing on the ultimate goal of being able to pass their licensure exam and leave us with a well-rounded education and very knowledgeable in the key concepts they need in order to be successful. We use every tool that we can to give us that continuous feedback on how our students are doing. So we take all of these standards and we map them, and we use ExamSoft to do it. We found it is really good at enabling us to capture data from students. So we're capturing all of this, and there is a little work to it initially, setting up the system, but you got to think in the end, who wants this data? It's okay putting in the time to collect this data if you know in advance how you want to use it. And I want to talk about how this data is used and why it's meaningful to us, particularly in professional schools. For the students, they want to know, of course, how am I doing along the way? The faculty are always asking, you're teaching for us a class of 80 students and they're staring up at you and you want to know, are they really getting this? Do they really understand the material I'm teaching? The administrators want to know, certainly, how are we covering the entire curriculum? Do we have any holes? Do we have any gaps? Do we have areas where we need to improve? And the accreditors, frankly, want to know, what's your evidence? Everything is evidence, evidence, evidence. What is your evidence that students are learning? And we don't want to rely just on a summative assessment at the end of the day. We want to know how students are learning throughout the program. So I'm going to start with the accreditors and work backward toward the most important audience, and that is, of course, the students. When the accreditors are looking for evidence of student learning, regardless of what accrediting agent you're reporting to, the assessment cycle is pretty much universal. It's a four-step process. It should look very familiar. First, you develop the written statement or learning outcomes, and in the professional schools, these are given to us. Now, that's a big advantage. You'd be surprised how many people get caught up on just writing the outcomes they want to see out of their program. If you're in a liberal arts major, you might not have clearly defined outcomes presented to you. In the professional schools, they're listed. You know exactly what you're targeting. So, of course, you can layer that with outcomes that make your school unique and give it personality and make it differentiates it from other schools, but your fundamental learning outcomes are prescribed. Then we look at designing the experiences that give the opportunities to achieve those outcomes, second step in the assessment cycle. And of course, this is all listed in the course syllabi. So if you have a course syllabus, it's going to say, these are the learning outcomes I'm teaching, and this is how I'm doing it, whether it's a lecture or it's group work, or generally this course syllabus will explain that. Then you're going to assess the student achievement of those outcomes. And of course, there are exams. There are multiple ways of doing this, and we'll talk about rubrics and performance assessments. But basically, we're using existing assessments, whether they're performance assessments through a rubric or a traditional exam. And closing that famous loop on the cycle is using the results of the assessment to improve both teaching and learning. So from the accreditor's point of view, they want to know that you're completing this assessment cycle. And you can't say, oh, yes, I'm completing the assessment cycle. You need to provide evidence that you're doing this. And in capturing this data the way we do, we are providing that evidence. From an administrator's perspective, one of the biggest questions that assessment professionals, deans, department chairs, and provosts are all asking, are we covering everything we're supposed to be covering? Are we addressing the curriculum that we say we are addressing? And the old curriculum maps, people who have met with me at different conferences certainly have seen this before. This is what our old curriculum map looked like. We've got our courses running down over here on the left. We have our learning outcomes. You put the X's where you cover them. And if there are no columns there without an X, you're fine. Your curriculum is covered. Well, we've gone past that quite a bit in terms of providing evidence of student learning. We're matching our learning outcomes with the student achievement on those outcomes now. So now if in this example, learning outcome 3, I know it's addressed in these courses, but I also know that at this point in time, the students were not performing very well on this learning outcome, which of course informs change. Now there is no program in the world that's going to be absolutely perfect. And the accreditors don't expect that. No one expects that. What they do expect is for you to know where your weaknesses are, know where the students aren't performing, and have a plan to address that situation. In this example that I'm giving you, it was a live example from a point during the semester. So at that point, they had some students had difficulty at this learning outcome, which certainly makes you go back and look and say, all right, what is it they're not getting, so that we can remediate quickly and take care of that long before the end of the semester, much less the end of the program. The faculty are wanting to know, of course, are my students getting the information that I'm teaching? Now, when we use ExamSoft and we launch an exam in ExamSoft, the faculty have access to a report as soon as they complete the exam. I know this is difficult to see, but I just want to, and I'm going to blow this up in a minute. If you get, I love the summary report, because at the very top you're going to see a quick snapshot of the exam performance. You have your high score, your low score, and your average. You get a quick histogram of it. You're going to get, and this is what I'll blow up for you in a moment, a breakdown of how the students did on the learning outcomes. This section that's blurred in the middle will give you the 27% of the students at the bottom, so that you immediately know who needs your attention. And one of my favorite parts is this, the bottom section that will tell you how each question on your assessment performed. So you can see, are there questions that really didn't perform well? I get the descriptive statistics, I see the distribution of responses, and I can take a look at where there's confusion in the classroom by looking at that report. So looking at this a little bit bigger, the middle section of that summary report gives me shows me how the students are doing on the individual learning outcomes. So in this case, in anatomy and physiology, the green is telling me my high score, the blue is showing the median, and the red is showing the low end of the spectrum of the scores. So I get a quick snapshot. Of course, I can get much more detailed reports out of this, but I like right at the beginning to see where the students are generally on the learning outcomes. Again, this continuous feedback of information. How are they doing on those key outcomes that we need them to grasp? So at the course level, now that was really looking at the exam level. If I'm taking this to a course level and I'm a faculty member, at the end of my course, I'm going to look and say, well, all right, I had 5 learning outcomes to cover. I assess those learning outcomes in various ways on exams, papers, performances, whatever the case may be. I put the student averages in, which I've collected from ExamSoft data. And in this example here, I see that there's a low point. Learning outcome 3, the students only scored a 71.1. Now for us, that's 1.1 above failing, because 70 is failing for us. So that's not a very good outcome. So I'm going to look at that learning outcome. I'm going to take some actions. I'm going to look at how I taught it, how much I supported it, maybe with reading assignments that I gave, with group work that I gave. Try to figure out where the confusion is with the students so that I can remediate, address this, and strengthen that learning outcome. Again, these learning outcomes are not necessarily at the level that they'll only be taught in my course. I know these are key concepts that are going to be carried into other courses as well. We don't want to just drop it and pass it on to the next class. We really do want to look at where the students are floundering, if you will, or struggling the most, so that we can address it early and often in the program. And in this last column, this is really important that we have our faculty just make notes on what actions are taken based on the information that they have. So if they've identified a weakness and you said, well, you know what, I discovered this weakness, the students really need more case studies. And then you say to yourself and to your students, we're going to add additional case studies on this because you're not demonstrating proficiency in that area. And you make a record of that. The next time when you teach it, you will have taken evidence-based actions and made evidence-based changes to your course syllabus. It's really critical for everyone up the line, including the accreditors, to know that you're making those evidence-based changes. Another thing I want to point out on this is, in addition to looking at the student averages, we look at the density of the number of items in an exam or a performance that support that evidence. So in this case, you know, if you look at learning outcome 4, there were 60 items, but in learning outcome 5, there were 19. Now, there may be absolutely nothing wrong with that because maybe 4 should be weighted higher than 15, but it should be intentional and not accidental. We had a faculty member who I mentioned scholarship of teaching and learning here because he looked at his data similar to this over a 3-year period. And what he discovered is he was shortchanging some of the learning outcomes, not intentionally, but quite accidentally. He was giving more time and more test items to the areas where he was most comfortable and that he enjoyed teaching the most, quite frankly. So he adjusted the time on the learning and he adjusted the time on the exams so that this was more balanced or more intentionally balanced. And then he tracked the student's performance over time. And he was able to demonstrate improvement in the student learning over a 3-year period. Of course, you know, it is different students every year, but the average overall went up for his low areas. And he's documenting the changes that he made to his syllabus and how he was teaching in order to support that change. So it's a really good example of using data to inform change at the classroom level. And he did write it up, and he was published in a pharmacy education journal, so we were really happy to see that. there are opportunities for scholarship of teaching and learning with mining assessment data. Taking this information to a program level, so we were just talking about individual faculty and looking at their courses. Now we're looking at the program level. For example, we track how students are doing at the system level, so cardiovascular, respiratory, et cetera. We actually track 19 different system breakdowns. So here's 8, for example, and at one point in time, this is where we were at in terms of the number of exams that address those, the number of test items, and the class average. Renal system. For some reason, and I've seen this in other schools as well, renal students struggle with. So we're really working on that. But this is programmatically because that renal outcome is not addressed in one course. It's addressing course after course after course. So this is a shared target and a shared data set, so that we can look at the whole program and say, all right, programmatically, the students are weakest in the renal system. Now we go back to the faculty of the curriculum committee and say, where can we bolster this? How can we give the students more time on the renal system such that we can pull these numbers up? And also, look at the coverage here. Maybe 110 questions in that area isn't enough. Maybe we have to test that more frequently and give it more lecture hours. So the bottom line is we're going to be making some evidence-based changes to our curriculum based on the data that we pulled out of our exams. Now, at the student level, the most important stakeholders of all, they always want to know how they're doing. If your program is anything like mine, the students are very tuned into their grades all the time. They want to know how they're doing. And particularly, they want to know how they're doing, not just themselves, but they're competitive and they want to know how they're doing in relation to their peers. Well, just as we have a summary report for the faculty, and I know this is hard to read, but just kind of get the visual of it, the point I want to make is the students get a very similar summary report. And they're going to get red, yellow, green, and the green is going to indicate, well, on this learning outcome, you're ahead of your class average. At the yellow, you're at or, pretty close to the class average. And if it's red, as it is in this case here, you're below the class average. So if I blow that up a little bit, they also can get a summary report that looks like this. In this item, okay, the class average is only an 80. It's not that great. But you know what? I'm at an 81, so I'm right at the class average. So it gives you the class average on the right, and your performance is on the left. So you're going to get to see how you're doing in relation to the class. In this case, in the bottom one, the student is doing much better than the class average. So just as the faculty are monitoring the progress on all those learning outcomes, the students are similarly monitoring their own progress. And I mentioned rubrics very briefly. Well, in ExamSoft now, we're able to evaluate students' performances. We do evaluate students' performances for group work. It might have a case study that you have students working up together, or a joint presentation. The other thing we absolutely assess with rubrics is we have counseling sessions with standardized patients. And we actually put iPads in the hands of all the reviewers. They have the rubric that is appearing on their iPad right in front of them, and they're evaluating the students live on the dimensions of the rubric and the point scale. What is different about doing it this way is this column over here, because every single dimension on the rubric is categorized or coded to a learning outcome. So again, we're not just saying, well, here, you're doing a presentation. Let me give you an example. One of the learning outcomes might be your oral communication skills, and another one might be the demonstration of an apparatus that you're showing to, let's say, an inhaler to a patient. Well, on the demonstration piece, you might have done exceptionally well, but on the oral presentation, you may have done very poorly. So you're able to disaggregate that and report to the student exactly where they did well, and the learning outcome, or your knowledge of the content was great. Your presentation of it to the patient, not so much. So you can break out those learning outcomes, and when the student gets a report back on a rubric, they will get your notes per item, per dimension within the rubric. So if on learning outcome 1, the content area was strong, you will get the strong comments. And on your presentation or your demonstration of an apparatus was weak, you'll get those comments as well. Again, we're looking at the data that we're already collecting, we're breaking it down, and we're using it to inform the students, where's your strength, where's your weakness, and they are vested in getting better in this, because they, just like we know where the little licenses are coming at the end, the students know it. They're predisposed to want to address their weaknesses. So it all starts, again, with mining the existing data. We take our test items that we've always created, and we take our rubrics that we've always created, and we input them into this giant test bank that we hold in ExamSoft. We take every single one of the test items and we tag them or code them to the outcomes that we want to track. So now my test items are matched with the outcomes. And by the way, one test item can be matched to 5, 6, 7, however many outcomes. We might ask a case study question that involves 3 disease states and a recommendation for a prescription, and it's going to be coded at multiple systems dealing with those disease states. It's going to be coded at the level of Bloom's taxonomy. In this case, if it's a rich case study, is probably a synthesis level. We're also going to code that on, there might be systems pharmacology involved, there may be pharmaceutics involved. It's going to be very richly, deeply coded, so we know how many outcomes a single item might address. Then we're, of course, going to give the tests. Now they're all coded, all the items are coded. We're going to assign the performance, we're going to give the test, and we're going to evaluate them. We're going to grade rubrics, we're going to evaluate the tests, and then we're going to run the reports. And when we run the reports, again, the faculty is going to get this nice, rich data set that they can use to inform what's happening in their classroom. Simultaneously, the students are getting a nice, rich data set to tell how they are doing personally and how they're doing in relation to the rest of their class. So basically how we use ExamSoft is we manage this enormous test bank. Now I think we're up to over 7,000 test items in our test bank in ExamSoft. The students take their tests, we execute it in a computer-based environment. So we are away from paper and pencil, no more bubbling. Although ExamSoft does read Scantrons, we do not use them anymore. We have a laptop requirement. Our students take their exams on the computers, although they are not web-based. They download the exam to their computer. They take the exam offline, and then it gets uploaded by the internet when they are complete sometime. And then we analyze the data. Of course, all of this is to get to the point where the data is easily accessible and ready for us to analyze to serve those multiple constituencies, the students, the faculty, the administrators, and the accreditors. So what I think we do very well is capitalize on the culture of assessment that is heightened in the professional school environment. Not everybody has that benefit. I have a colleague in general education who struggles just to get the faculty to understand the value of having clearly articulated learning outcomes, much less being held accountable to how your students do at the end of the day. So, well, I've taught a good class. It's up to them to learn, right? Not so much in the professional schools. You do teach a good class, but the expectation is if you accept those students, and you, for the most part, many of the professional programs have very rigorous standards for entrance. The expectation is your students will be successful, and you will report those success rates. You will report those licensure pass rates on your website and to your accreditors, and people are drawn to programs that can report very high pass rates. So when you think you have it rough in this process, start to think about your colleagues in the liberal arts who don't have that carrot or that stick, depending on your perspective, of the licensure exams and having to report the pass rates. That is a tremendous asset that I think we really need to capitalize again, and people who are already predisposed to collecting data, which is the case. And I have consulted now with schools of nursing, podiatry, chiropractic, dental, pharmacy, and osteopathic, and I found the same thing in every environment. The faculty are tuned in. They absolutely know the need to check on the students' progress on learning outcomes continuously. They do not want surprises. They do not want to wait till the end to find out how the students are going to be doing. And just giving a test grade doesn't quite do it. A test grade, it gives you one question. It's not an assessment unless it's tied to a learning outcome. The learning outcome is evaluated. We break it down. We say, how are they doing on every learning outcome? And that's an assessment of how the students are doing. So again, we use ExamSoft in order to be able to manage this a huge amount of data that we have. One of the things I want to say about that amount of data too, in our environment at the Wegmans School of Pharmacy, we keep 100% of the data transparent and accessible to all of our faculty. There is not a single piece of assessment data that I have as the Dean of Assessment that every single faculty member also doesn't have access to. Every faculty member can run the same reports I do if they forget how. I serve as a resource and I help them. But it's very intuitive. They can get their own classroom data. They can get their longitudinal data for a semester, for a year. Certainly at every single exam, it's very simple to just print out a summary of their exam. The availability of the data is key because now I don't own assessment. The entire faculty body owns assessment, and to a huge extent now the students do, because the students are able to access their own data on a regular basis. So I think that is really important. And with that, I wanted to make sure that I saved room and time for questions. And Carter, are you there? And do you have questions from the audience?
I do have some questions, Jane. Let me see. So for the first one, how do you help faculty interpret Bloom's taxonomy? Do you have any best practices or tips for that?
Oh, absolutely. I'm glad that question was asked. We all know that Bloom's taxonomy has 6 levels, and I have yet to be at a single institution that is able to assess or adequately categorize to 6 levels of Bloom's taxonomy. It is very difficult to do. So most people have done what we have done. We've taken them in 2, so the knowledge and the comprehension together, and we just say knowledge. And then we say application, and then we use synthesis. So we use 3 levels of Bloom's, but kind of combining the others. And I certainly do professional development that and offer charts on how to assess that. But we can pretty reliably take a question and break it down to, is it simply recall and knowledge? Are they applying that knowledge, or are they synthesizing the knowledge and using to make evaluations, recommendations, prioritizing? So we can do knowledge application and synthesis. I recommend that. There's only one school I've ever been at that was trying to code to 6 levels of Bloom's, and I tested them on it. I gave them questions, said, okay, code them. And I think we had, I don't know if we had all 6 levels represented on one question, but we might have had 4. And remember, if you can't code with accuracy, then the data isn't any good. So my tip is to code to the greatest accuracy that your faculty are able to code to after you've given them professional development. And for us, that's 3 levels: knowledge, application, and synthesis. Good question. Carter, do you have another question? Okay, we don't have another. Did I lose Carter? I fear that we are having some technical difficulties. I cannot
Jane,
tell
can you hear
if,
me?
yes, I can hear you
Okay.
now. Do you have any other
Okay.
questions?
Yeah, we do. So do you have any experience with tagging objectives for courses that deal with like healthcare delivery practices rather than something like pharmacology or A&P?
For healthcare delivery practices, if they mean more authentic assessment performance evaluation, yes, some of the schools do code to that. I think anything that you have identified, pretty much you can code to. So if you have identified your learning objectives, you have also identified how you're going to, how do you know that when the students have achieved them? That's the fundamental question. So, and how you know the students have achieved them will include some form of assessment, either in an exam or in a performance-based assessment. And the performance-based assessment you would have on the rubric, and again, you would tie those back to your learning outcomes. So I don't see them as much different. So I don't know if that answers the question, but as long as you can articulate the learning outcome you're after and how you're going to evaluate whether or not it has been achieved, you should be able to do this.
All right. I have a couple of questions that deal with curriculum mapping now. So how do you calibrate how many hours you dedicate to a particular subject? And does that come into play whenever you go back and look at the data that you're receiving?
I'm sorry, I lost the audio for a minute. Can you repeat the question?
Certainly. It was how do you actually calibrate the number of hours that you're going to dedicate to a particular subject? Is that something the faculty deal with on their own, or is that something that the curriculum committee gets involved with?
Actually, it's a combination of both. The faculty within the departments look at their learning outcomes and determine, well, first of all, how much time do we have in the semester? They look at the learning outcomes and prioritize them and weight them and give the number of lecture hours according to the weight that they assign them in the curriculum. This is done first at the department level and then at the individual class level. It is reviewed by the assessment committee. I will tell you the faculty have gotten very creative in terms of how to map that now to their assessments. So at the assessment level, for example, let's say I have 45 hours in a course, right? And 20 hours are on this, 10 on this, 10 on this. The faculty gives the number of test hours, the number of test items in relation to the number of lecture hours on it. We have a lot of classes that are taught by multiple faculty and say, okay, you had 10 hours, I'm allowing 15 questions per lecture hour, so you have 150 questions over the course of the semester. So, and they divvy up the questions by the number of lecture hours. And they use that to create their exam blueprints to say, okay, we've had 20 hours since our last exam. It was split 5, 5, 5, and 5, so everybody's got the same number of questions. Or maybe one faculty had 10 hours of those 20, and others were divvied up in twos. So they distribute the questions on the exam according to the lecture hours that were given. So I think that once they've identify how much time is given on every learning outcome, they use that information really, really well in order to create the exams, map the exams. So our faculty are really good at doing that.
Very cool. Kind of wrapped up in there, Jane, you answered my other curriculum mapping question that I had. So let's move on. Do you take any improvements in teaching and learning into account for tenure making decisions? Like whenever you go back and look at the data and see that there were improvements, do y'all actually take that into account with tenure?
Well, our faculty have come to me very often, and recently I've just worked with 3 of our faculty to help generate longitudinal reports because they wanted to see how the students were doing on their specific test items. So they could generate longitudinal reports. We dig that data out of ExamSoft by faculty name, and then they get this nice report that they include in their promotion and tenure dossier. Right now, in the promotion and tenure dossier, you're supposed to show evidence of good teaching. Now you think about, what do you have to put in there for evidence? Well, a lot of faculty were relying solely on student evaluations, which we know is very subjective data, and it's indirect data. If you want to put something more direct for promotion and tenure, you put out, say, here are sample some of my questions at the multiple levels. This is what I advised a faculty member to do. Put a couple of sample Bloom's taxonomy knowledge level questions, a couple of application, a couple of synthesis, and then show overall, for the course of the last academic year, how did your students do on the questions of each of those levels? And it's really producing some nice evidence, some nice reports for the faculty to be able to say, this is how my students are doing on these different levels of Bloom's taxonomy, how they're doing on the different learning outcomes for which I am responsible. So the faculty are really getting a lot out of pulling that data. Again, they can do this by themselves. Sometimes they forget how, and they come to my office and I run the report for them or with them, and then they can pull this out and use it.
Thank you, Jane.
Question.
Yeah, next one. First, a comment. I had your screen minimized, and I just maximized it, and I see your granddaughter, and I guess that must be your daughter. So just letting you know. Just in case.
I am trying this, in order to make this project work today, I had to do some very funky things with my screen, and I can't even get to something that I wanted to get to before. So
oh, no.
yeah, so I apologize for what you're seeing. This has to do with those technical difficulties that we were experiencing earlier. So my apologies.
Well, you have a beautiful family. Okay, so the next question is kind of student focused. So how do you actually talk about the data that you get back out of the system with students? Is it in one-on-one meetings? Do you show it to them and then let them just approach you if they feel they need to? How do you go about doing that?
How do we get the students involved on this? Well, what we do is we require the students once a semester, usually around the middle of the semester, we require them to pull their own longitudinal reports. That means they go into ExamSoft, and there is a button that says Ask for Reports, My Performance, and they get a, you can set the parameters. So in other words, you could say, how am I doing from this September until now? Or let's say they're halfway through the semester and they say, no, I want to know how am I doing learning outcomes. This is my third year in the program. I want to know from day one of the program. So they can run the longitudinal report on themselves, setting the time parameters that they desire to look at. So let's say I'm a third year student. I want to know, it's the beginning of the fall semester. I want to know how I did on all of my performance indicators for the first 2 years. I run a report on that. I am required to go to the faculty advisor, meet with them, and discuss my longitudinal report. They must go over this report and say, okay, this is how I'm doing. I'm weak in respiratory system, or I'm weak in calculations, or I'm weak in this. And we use that data to help the students focus their studying, particularly as they get closer and closer to the licensure exams. Now imagine you have all of these learning outcomes, you don't know where to start studying. Well, if you're looking at a longitudinal report and you find out you have a weakness in cardiology, well, that's where you're going to start studying. So the students are required to look at their own longitudinal reports on a semester basis, meet with their faculty member, and have a discussion. On the flip side of the remediation, I will say we also use that data to identify students who are very strong in areas, and then we might ask them to serve as peer tutors. So that's a really important thing that we do with as well. Not just use it for the weaknesses, but also identify the strengths.
All right, let's go for one final question, and then we can sign out of the webinar. And for all the attendees out there, I do know that there are questions that we haven't gotten to. Just know that whenever we make follow-ups off of this webinar, we'll be sure that those questions are addressed. So the last one is there any IT personnel or a staff support person that supports ExamSoft at your school?
I'm at really the IT the ExamSoft is hosted not at the school but hosted by ExamSoft. So we don't need a great deal of technological assistance in that respect. We have our every client of ExamSoft is assigned a support person there, so I have my support person to call. But I will say on a daily basis when exams are being given, here's how I manage it. I get a schedule. One of the administrative assistants gives me a schedule of all the exams that are going to happen in a given week. So let's say I've got Monday at 9, Tuesday at 10, Thursday at 12, whatever. I've got this list of when the exams are going to happen. I arrange for one of us to be in the room in addition to the faculty proctors. I always arrange for someone else to be in the room just at the start of the exam, just in the case that there's a problem. That's a tip that I give. It cuts the stress level down of the faculty. We have yet to lose an exam. We have yet to have a problem we couldn't solve. But just to have the extra support for the faculty while the exam is first being launched, I'm spread too thin, so I can't usually make it, but I've developed a cadre of people in the building who could just go down and say, yeah, I can cover the first 10 minutes of that exam just to make sure no one's having any trouble. And usually the trouble that we have has to do more with the students' own personal computers than anything else. So either they've forgotten it and we have, some laptops on hand, they forgot their laptop that day. I mean, silly things like that. Or somebody, is having issues with a computer and won't boot, or they think they've lost the exam and you just reboot and it's there again. Nothing tragic, but it's not any kind of technological expertise that you have to have people who know technology. I am not an OIT person, but I certainly can troubleshoot and manage most of the difficulties that anybody would have. You can tell I'm not an IT person. I can't make this crazy screen thing go away on my computer. So I opened up my ExamSoft custom homepage, which is showing it this really strange proportions on my computer. I don't know how you're seeing it. That's part of the technical difficulties we've had today. I truly appreciate your patience with this. Thank you for joining me, and I hope that you send your questions into ExamSoft so we can be sure to follow up with you.
Certainly, and I would second what Jane just said. Thank you so much for putting up with our little beginning bubbles that we had, and thank you, Jane, for sticking through those technical difficulties as well. You have no idea how much we appreciate this. And to all the attendees, thank you for joining. And like I said, we will be following up with any questions that are left. And you can expect a recording of this webinar to be delivered to you via email in about the next 48 hours or so, if not before. So thanks, everybody. Jane, do you have anything else you'd like to say before we log off?
No, just thank everyone for joining me, and I hope to see you at a conference in the future.
Certainly, certainly. All right, signing out now.
Bye-bye.